Hey, Happy New Year. So, the first 72 hours after you've placed a loved one in a nursing home can be very emotional for them. Um, and video is going to kind of look at what's normal, what's not normal, and how you can help. I also want to kind of focus in on, just your regular aging, frail person versus dementia, because those are extremely different in how you're going to have to deal with this. Dementia patients do not like change. So, and yet, you know, most of them cannot stay home unless you can afford 24/7 care. Um, and they've been in their home for 50 years. And I've had experience with that, and I've seen that it's definitely better to do that. But, that doesn't work all the time. So here's what we're looking at. You've got a new environment, okay? And it can be overwhelming. Um, just a sensory overload, new people, new smells, new everything. So if you have dementia and you're being thrown into that environment, hopefully the place that you're putting your loved one, and there again, we've talked about this in earlier videos, but you need to really visit and see how they react to these dementia patients and the patients that they have, like dealing with them. The nurses and the CNAs especially, it's very important that they're speaking calmly, and they're trying to do what they can to be welcoming and helping them to adjust to this new place that they're in, because sometimes I see, sadly, that is not the case. So you've got this overload brain stimulation, and you've also, for just your everyday older person who has to go for whatever reason, they've lost control, they've lost their routine. I don't know if you can put yourself in their shoes. It's very important because, it can be you one day. And believe me, it gets here sooner than you can even imagine. So, what is normal to look for in these first 72 hours? They could be angry. They could be confused a little bit. They might be definitely sad and saying, I want to go home. Why did you put me here? The guilt. Um, and we'll talk about that in another video. But loss of appetite, with sleeping more, just being tired. They may withdraw socially where they've always been social. So this is just an adjustment process. And you need to realize that, okay? So, and some are going to adjust quicker than others. I say the first 72 hours, but, it really can be a lot longer process than that. I want you to, let's talk about maybe some things that you might be concerning um, at a place. And maybe you visited multiple times before you put them there, and everything looked great, and the staff seemed great and all that. So, and that's why you chose the place for a reason. So you got to go with your instincts. If that place felt good, and then you put your loved one there, and all of a sudden they're saying all kinds of things about the place. I do want to clarify too, for like Alzheimer's dementia patients. Um, one of the, especially in the early stages, is that they think everybody's out to get them. They're paranoid about things. So you've got to take all that into consideration, and your loved one best. So you just have to, like I said, go with your instincts and try to just wait it out and see how things are going. But here are some concerning things maybe that you want to look for. A rapid decline in 72 hours would be concerning. Physical, mental, either one. Dehydration, where they're not getting anything to drink. And there again, so we're talking about a completely, it just depends on your loved one. There are people that are bedridden that can't do for themselves. So if nobody's coming in and giving them anything to drink, they could get dehydrated, versus somebody who's up and about and can get their own. If they're still not drinking, that might be an issue. New or worsening pain that they could have, just all of a sudden. There again, there's things to watch for. And we've discussed this ad nauseum, I'm sure, in other videos about the staff, but, call lights being answered, and there's a lack of concern by the staff about your loved one would be concerning to me. Okay. But I'm hoping, because you've done your research, to put them in a place that you feel comfortable with, then, then it comes down to, yes, this is just an adjustment period. What can you do? First of all, you need to visit as much as possible and at different times of the day. We've discussed this before. As you are looking for a place, you should do that. And when your loved one is there. I've seen people put people in a nursing home and they're there 24/7 for the first week or so. And I've also seen they put them there and then you never see them again. So, that's, and there's a broad spectrum in between that. So if you're placing your loved one in a nursing home and you're watching this, I'm hoping then that you are concerned about their well-being and that you're probably one of the ones that are visiting. But just go at different times. Go at breakfast. Go at 11 o'clock at night. Go, whenever that you can see what's going on, because you've got, depending on, some people work 12-hour shifts, 7 to 7. And then if not, you've got 7 to 3, 3 to 11, 11 to 7 shifts. And especially 11 to 7, you're going to find shortages, one CNA to all those patients. So, there just needs to be some diligence on your part to try and help the adjustment period go as smoothly as possible. I want you to speak up, but especially in the first week or so, you don't know them, they don't know you. Be calm, be respectful. Most of those CNAs are doing the best they can with what they have, and I think it's very important for us to treat them that way, that they're doing a job that obviously, you couldn't do, and they're there because they want to be there to help your loved one for the most part. And I know I've shown the other side of that, and that's definitely an issue too. But just give them the benefit of the doubt, especially the first week or so that you're there, and be kind and considerate with your concerns. I come from both sides of the spectrum. Like I've said, I've worked there years and years and years and years in all kinds of capacities, and I have been a CNA for years. So I know that side, and I know the family side. And I'm just asking that would be true. And you need to just give it time. Trust your instincts for sure. And your loved one best. But an adjustment period does not define the whole future for them. A lot of people it just takes them a little time. And then if you've got loving staff that coerce them into, coming out and getting involved in activities and meeting friends, and a good nursing home would have even maybe a welcoming party for the new people that are there. It's always a good idea. And like I said, so the dementia patients, just quickly at the end, it's so complicated because everybody's different. And even with dementia, it's just so important that the environment be calming and be as much like home as possible. And that their routine could be similar to what they're used to. Just, change has to be done gradually with most dementia patients. And if, you throw them into, like I said, you throw them into a new environment, it has to be done. I get it. So let's just try to make that transition a little smoother. And, a lot of it, just like I said, it depends on the level of dementia that we're talking about, the paranoia or any of that. And, we'll talk about showers and baths and all the things that dementia patients don't want to do. We'll cover that later. But anyway, I hope that y'all have had a wonderful holiday season. And I know this is a new year, today starts 2026, and you may have to make bad decisions, not bad decisions, but hard decisions this year. I mean, I could. So you just never know what's coming down the pike, and I hope this is a great year. And let's just band together and help each other out. Thanks.